Welcome to Chapter 6. Let's talk about the muscular system. Muscle tissue is going to be discussed in this chapter. There's your introduction. Types of muscles are reviewed. So we have smooth, we have cardiac and skeletal muscles to discuss. Again, let me just say this in this video. This is not an anatomy course. This is a medical terminology course. I do not expect you to memorize these figures, identify the exact muscle and location. If I were to ask you about a muscle in a diagram or what have you, I do want you to know where to go look that information up. So please read the chapter, review the chapter, become familiar with it. But I don't expect you to become an anatomy expert from this chapter. But moving on, the skeletal muscle. So the muscle structure is made up of fibers and fascicles, fascia, tendons. The tendons attach the muscle to the bone, etc. So review that information. Know, at least have that knowledge. Muscle action. This is really getting into some deep anatomy, biology. Review it. I do not expect you to become a mitochondria synaptic expert here. However, just side note, this is what makes my videos so long. I'm sorry for my side note, but mitochondria regenerate. One of the big topics right now is red light therapy, etc. The best red light therapy in the world, and it's free, is the sun. If you just sit out in the sun with some skin exposed, as much skin as socially acceptable to be exposed, 10, 15, 20, 30 minutes a day, you can refresh your mitochondria. So side note there. But that's important for the neuromuscular um, uh, activities and muscle repair and skin. And please don't sit out there and blister in the sun, but all of us, no matter how much melanin in our skin, that sunshine will help rebuild and repair some mitochondria. But that has to do with muscle and skin and skeletal and all the good things that come with renewing our body. Okay, see, I digress. So let's focus on this chapter. Okay, so the chapter goes into steroids. If you've ever seen or wondered, bodybuilders, boxers, wrestlers, different athletes who illegally use steroids, there's some severe side effects. You can read that yourself, but you don't want to do that. You want to naturally build your muscle. You want to naturally improve your muscle skeletal system with diet and exercise, and not dieting, but eating whole foods, drinking water, etc., getting those nutrients that's required of us as human beings. For your reference, types of movements here. Abduction is a common one. Extension, will flexion to pronation, supination. These really, if you're going to, work somewhere in the operating room, or I guess orthopedics too, those would be important to know. But just review this, just become familiar with this knowledge. Here are I must have said videos. That's not a video. That is a picture of what it is: abduction, adduction, circumduction, rotation, etc., supination, pronation. Careers in exercise and fitness. I talked about this in my other video too. Lots of healthcare opportunities when it comes to muscles and our skeleton. Exercise physiologists, athletic trainers. Athletic trainers are a unique group because they can actually diagnose where, for example, nurses at the, what do I want to say, a regular level, I guess, a regular registered nurse, we cannot diagnose. When we earn our master's degrees, and if we're an advanced practitioner nurse, like a nurse practitioner, even in the physician world, like a physician assistant, they can diagnose. But athletic trainers can, so that's pretty cool. And just my little opinion over here. Fitness workers, Pilates instructors, things that have to do with exercise and fitness. That is an excellent career. So that's something that would go more to prevention, where medicine itself, healthcare itself, is not really good at preventing. We're in the treating business. We're in the business of treating injuries once they happen. But there's a whole world out there to prevent. So naming the muscles, there's they name them by locations, direction of the fiber, the size, the shape, the number of attachments, and the suffixes and all are going to be listed in this chapter. I do not expect you to remember this. You can memorize some of the big ones, if that makes you happy. But again, this is just not an anatomy class, medical terminology. Just know where to find this information if you happen to see this on a quiz or a test. But some of them make sense. So that this is the fibula bone. This is the tibula bone, and look at there, tibialis anterior is the name of one of those muscles. Um, Obliques, some of you, if you know anything about exercising your abs, obliques are talked about quite a lot. There's an external and an internal oblique. The deltoid muscle, I just happen to know that's deltoid because of all my years of nursing and administering shots and the deltoid muscles for vaccinations. Quadriceps are here in our legs. You have a calf muscle. Let's see where that one is named. It should be on the back side. There we go. So I call it calf muscle. It's really a let's see, nemesis. I don't know. No, that's not right. I'd have to like look that up myself to learn that one. Your hamstring's on the back side, but your hamstring group is made up of bicep femoris, semitendinosus, and semimembranosus. Say that fast 5 times. Gluteus medius and the gluteus maximus make up our buttocks muscles. Triceps are on the back of the arm. Look how big that deltoid is. That deltoid muscle goes from the back of your arm all the way to the front. That's a pretty big muscle and controls a lot. Anyway, review these diagrams. Terminology, here we go. Acetylcholine, actin, agonist, antagonist, cardiac, fascia, fascicle, insertion. I want you guys saying these out loud too as you read, and just practice saying the terminology. You don't have to get it right. Like I didn't get that calf muscle right at all. I'll have to look that one up. Um, but just practice these as you go along and learn these terms. So here's the root words listed: myo, musculo, fascio, tono, ergo, kino, keen, kinesiology, Kino, Connect, Kineto. See, you just practice them. Say them out loud until you get it. The exercises here are listed. You know the answers are in the back. Clinical aspects of muscles. There are 7 disorders listed here. Review them. Muscular dystrophy, polymyositis, yep. Hang on, let me slow my head down. Polymyositis, myositis, inflammation of the skeletal muscle, y'all. Read about that. Fibromyalgia syndrome, chronic fatigue syndrome, myasthenia gravis. And then the 6th one is amyotrophic lateral sclerosis. And the 7th one are stress injuries. So 7 different disorders in this chapter regarding muscles. Review those. You do not have to memorize them. Again, you're not going to leave here an expert in these, but I want you to at least know what we're talking about. Especially some of the ones here in this color blue, they're not as common. They do happen. You do need to know about them, but I will say myasthenia gravis is one that I hear some about, but muscular dystrophy is popular and stress injuries are very popular when it comes to our muscles. The ones here in the in between, um, they're not as common, but still be familiar with them, be aware of them, I guess I should say. Stress injuries happen too in our sleep sometimes. Sports, moving wrong, overuse, if you don't have if you don't have good abdominal muscles and back muscles, then you can definitely stress injury some of your other areas. Our core in our body is so important to keep it strong and healthy for our bones and our muscles. Carpal tunnel syndrome, this happens a lot from overuse, whether you're a pianist, a painter, someone who types on the computer all day long, tennis players, anything that you use that hand and train with that hand, dental hygienist, such as that. Terminology. Um, Here are terms emphasized in this chapter. It's listed out for you. It has your word and the what it means, the definition is what I was trying to say. Terminology listed here again, enrichment terms, normal structure and function. Yes, so just, again, be familiar with these. We talk about atrophy of muscles, atrophy of bone. I will say in our elderly population, I'm going to say 68, 70, 80, 90 year old. So, towards the end of most people's lives, atrophy really occurs because these people retire and they just kind of do nothing, which is not okay. If you don't use it, you will lose it when it comes to muscle. So even if you have elderly patients, elderly neighbors, elderly family members, friends, encourage those people to get up and get moving, even if it's just a 10 to 15-minute walk per day. Again, if you don't use it, you will lose it and the muscle will atrophy. And that is not a good thing. And that's just I said that out loud because it stuck with me. Restless leg syndrome. This is serious. This is really prevents people from sleeping and resting, and we have to have that good rest at night. There are some things you can do for this. Rhabdomyolysis. This is something that happens from taking. A lot of times, it's from taking supplements if you're exercising or working out. Um, this it can turn into a sarcoma, all kinds of things. Rheumatism, rheumatoid arthritis, muscle spasms are if you ever had a Charlie horse, if you're an athlete, if you've ever been running and you get like the tight oh my gosh, I can't think of what I was gonna say. Anyway, muscle spasms, tendonitis, those type of things can be painful. Tetanus is actually horrible. um, Disease, spasms in your jaw, locked jaw. There's actually a vaccine to prevent that if you ever step on something rusty or cut yourself with something rusty. That's where tetanus comes from, metal. I'm just picking random terms here to discuss. You're welcome to ask me about any of them. Here we go with some more abbreviations. Let me see if there's anything. Okay, so actually LLE, LUE, left lower extremity, left upper extremity, these are approved abbreviations at most places. OT, it does stand for occupational therapy at most places. PACU, I spent many of night shift working as a PACU nurse, post anesthesia care unit. This is where people come right after a surgery or a procedure. PTs, physical therapy, some of these are very common. Range of motion, ROM, that is a approved common one that you could learn. And here's a case study. And that is it for chapter 6. I'm not sure what we're going to do for discussion or an assignment, but stay tuned.